Hey, good morning. I'm Dr. Stites, Chief Medical Officer at the University of Kansas Health System and Executive Vice Chancellor at the University of Kansas Medical Center. I can say those words very quickly. This is Open Mics with Dr. Stites. As we age, some people focus on extending their lifespan, but remember, Spock didn't just say live long. He said live long and prosper. And he didn't just mean financially. He meant in your world. Today, we're asking how to prosper in the face of aging, and I'm talking with a couple of experts who can help us maximize our prosperness, I invented that word, of our health span, those years where we live without significant chronic diseases or disabilities. Joining me today is Dr. John Tifo. He is the director of the KU Diabetes Institute and co-principal investigator of KC Moore, the Kansas City Center for Metabolism and Obesity Research, and Dr. Bruce Troen, a physician who specializes in geriatric medicine. He is the director of the Landon Center on Aging and the division chief of geriatrics here at the University of Kansas Health System. Dr. Troen and Dr. Tifo are also both physician investigators of the Veterans Affairs Kansas City Healthcare System. Thank you both for being here. That's a lot of words, man. I tell you what, live long and prosper.
There you go.
Well, let's do it in fewer words because it takes too long, we're going to get old. All right, Dr. Tifo, one of the most common tips for overall health is to maintain a healthy weight. But a recent analysis published by the British Medical Journal found that it's more important to focus on overall fitness than the number on your scale. For older adults, especially in their 70s and beyond, what metrics should they use to measure their fitness? Be careful, I'm 65, I'm staring 70 in the face. Be nice to me here.
All right. Well, I think the most important metric is, can you do physical function, physical function of things in your daily life? Can you play with your grandkids? Can you go to the grocery store? Can you mow your yard?
Don't remind my wife I can do those things. At least go to the grocery store. Oh, great.
Yeah. But get out of a chair easily, go up the stairs, get things out of the cabinet. Things that you need to do for your physical life are usually good metrics of your fitness.
Okay, so 30 minutes this morning, Adrian Williams on Peloton worked hard at it, moving the weight. That's a good sign, right?
It's a very good sign. Yes.
Excellent. Okay, and you want to be fit, and you definitely do not want to be frail. Now, Dr. Troen, how do you define frailty in older adults? And can a little fat actually help protect you? You see all these guys who try to be super thin when they look old. I'm not sure they look as good as if you're like 20 years old and you're super thin.
Well, so frailty is a very, very important concept and actually has been burgeoning within the medical literature. So we know, and I'll explain what frailty is in a moment, but by the time 65 comes around, about 7 to 10% of people are frail. By the time 85 comes around, as much as 40 to 50%. So frailty blossomed into the medical consciousness about 25 years ago with a study by Linda Fried and her colleagues. And part of that was assessing people's gait speed, their grip strength, their fatigability. But when I think of frailty, I like to go back to a study by John Morley and colleagues where they used the mnemonic for frail: fatigability, resistance, can you climb a flight of stairs, ambulation, can you walk a city block, illnesses, do you have 5 or more, and L for loss of weight, 5% or more over a given year. But what John was saying is absolutely correct. It's about the basic activities of daily living. We can actually assess people's functional capacity by whether or not they can get out of a chair without using their hands. And by the way, when it comes to gait speed, it turns out that if your typical gait speed is less than 0.8 meters per second, you have an increased mortality.
You translate that into miles per hour here.
Oh gosh.
And that means how fast you walk.
Yeah, that's right. Gait speed, how fast you walk.
Yeah.
So does obesity protect you? So this is really a fascinating question because studies, I think, have come out to say that, and we'll talk about this, and John is really the expert here, but if you're fit, obesity may not matter. But my question is, if you're fit at 70, is that the same thing as being fit at 80? And so the ratio of obesity to your functional capacity probably changes as you get older.
So I think about it, when we talk about BMI a lot, and we say, okay, your ideal BMI is around 22 or 23. Is that still true when you're 65 or 70?
Great question. I mean, BMI is fraught with lots of problems, obviously, right? Because if someone has been lifting weights their whole life, or they just have a bigger frame like myself, they're going to have a BMI that says they're obese when they're not obese. And so the medical community is trying to kind of push back on that a little bit and say, okay, that's a great population health marker, but maybe it's not such a great marker at the individual level.
So it's a good target weight. I mean, like, Should you have a little bit of a belly as you get older? I'm kind of asking that for personal interest to see if I can eat more cherry pie.
There is evidence that you want to have, you don't want to be super thin when you get older, because if you have cancer or if you have an infectious disease like Dr. Hawk treats, your risk for losing excessive weight and becoming frail is higher. But at the same time, you don't want to have I don't want to say yes or you should or should not have a belly, but definitely, no matter what weight you're at, you should try to improve your fitness. That's what I do feel safe saying.
That's pretty darn good advice,
there you
right?
Go.
So,
very good.
Because we know that fitness does matter, so you can help live long and prosper.
Yes, absolutely. And really, as you were saying, it's about health span. Excuse me. Or another way to say it, and I didn't come up with this, is that it's not so much the years in your life, it's the life in your years. So again, this gets back to a holistic approach to how people can actually function, both physically and cognitively, actually. So a lot of what we're trying to do, certainly in the geriatrics field, is to pay attention to all these additional factors. There are social determinants of health. It's not just about whether or not you have heart disease or lung disease. It's about your supportive environment. Do you have the resources to be able to commit to a daily schedule or a intermittent schedule where you can engage in physical activity? And that might lead us in, if we have time, to talk about high intensity interval training.
Yeah, we'll get there.
Okay.
We'll get there. All right, so now, Dr. Troy, how do you shift the focus toward this functional fitness thing instead of weight loss? You guys have both kind of hit that a little bit.
Yeah. Well, part of it is, so if I have an opportunity to talk to somebody, there are three things that I ask about. The basic activities of daily living, that's dressing, eating, ambulating, toileting, and hygiene, and the instrumental activities of daily living. It's about shopping, housework, doing your finances, preparing your food, working on computers, and the third element is the frail scale that I mentioned before. If I hear those, then I get to know a whole lot about the person, even before I ask about any diseases.
Yeah, I can see that makes sense, because how functional can you be? So, Dr. Tiefel, how much does a person's metabolism slow down as they age? One thing I've noticed, like, okay, again, I'm 65, and as I can't eat quite as much as I used to. I'm still pretty darn active. I usually get 6,000 to 10,000 steps every day, and I work out 5 or 6 days a week. But man, the weight just comes easier.
Yeah, I have the same thing now, approaching my 50s. So it's a real thing, both anecdotally, and there are studies that show that as well. When you talk about body weight regulation, now when you talk about insulin sensitivity and metabolic health, there's some pretty good studies out there showing that aging doesn't really cause those things to decline as much as the inactivity that's traditionally associated with people who age. So as we age, a lot of us become less active. We have less active jobs, we have less active households, we just do less active things, and that's the primary driver of reduced metabolism in terms of metabolic regulation, like glucose homeostasis. But there is definitely something to body weight status being more difficult to maintain as you get older.
And we know that movement and insulin sensitivity are linked together too. Talk to us a little bit about that.
Yeah, so one of the primary disposal sites for glucose in your body is your skeletal muscles. Your muscle makes up about 45% of your body weight. And so you got to think about your muscles kind of like an engine in a car. If your engine's not running, then you're not burning fuel, right? And muscles the same way. If your muscles aren't contracting and being moved, then they're not going to take up glucose. So then your muscles turn off the ability to take up glucose and respond to insulin to take up glucose. So that's why insulin sensitivity and physical activity are so tightly linked. And it actually occurs on an hour-to-hour, daily, day-by-day basis. It's not something that you have to exercise for 6 months for insulin sensitivity to improve. There's studies showing, and we've done them, 1 day of exercise improves your insulin sensitivity.
That's dramatic, isn't it? So now, one of the things we talk about sometimes is our executive function. How well our brains are working, right? So, but even as you age, you can kind of feel like, okay, I can't quite do that math problem like I used to. I mean, I still do Nerdle and these nerdy games and math quiz games to keep things sharp and all that. But it feels like it starts to slide somewhere there.
Well,
what happens with that?
So let me back it up a little bit. So when I talked about the instrumental activities of daily living, they involve physical activity, but they require a cognitive superimposition. And we know that if you cannot compensate for changes in any one of those, then and need assistance, you likely have mild cognitive impairment.
Okay,
and
so
why,
talk to us.
Why is it important to know about mild cognitive impairment? Well, the challenge is that over the next 1 to 2 years, you have as much as a 10 to 15% chance of actually progressing to a real dementia. Now, I'll backtrack again. So what does change that's normal with aging? So first of all, we all lose our keys, right? And we find them. Though if you lose your keys and they're in the refrigerator, that's not a good thing.
I haven't done that
yet. But it's about processing speed. So as it's affected me and maybe others at the table, you don't really have the ability.
He implicated us, right? I think he just talked about me. Go ahead.
No, you're doing great.
Go ahead, Bruce.
But it's about the facility with which you can recall, right? So you may not be able to have that speed of processing. That's a normal change with aging. And by the way, as you get older, even if your processing speed and some of the other cognitive domains slow down, you can nevertheless still accumulate wisdom with age.
Oh, yeah.
Yeah, so that's a critical element.
I'm very wise. I've accumulated a lot of that through life experience and screwing things up. It's really brilliant.
Yeah. So one of the things that we do, we're keenly aware of, certainly in our geriatric population, is to try with a good history and some cognitive screens to get a sense for whether or not people are having trouble coping with those instrumental activities of daily living. And then first thing, to make sure that medications aren't affecting them, that concurrent medical illnesses are not getting in the way, but also thinking about the social support. I mentioned about all the holistic determinants of aging to try to create an environment where people can continue to be as functional, both physically and cognitive, as they get older.
Okay. So some people say they don't ever want to retire because as soon as their work stops, all kinds of health problems start. Gentlemen, is there a problem here?
Okay, well,
that's because he's saying you and I are closer than he is. He doesn't know the answer to that, but maybe you do.
So the answer is it's clear that that once you retire, things happen that were not happening before you retire. And there's a fascinating study that suggests that the later you retire, then the less your overall mortality. But it's clear that what happens before you retire is probably the most important determinant of how you do after you retire. And again, this comes back not just to medical conditions, but about the social, supportive, family, and economic environment that you exist in.
So what I'm hearing you saying is that the advice we say all the time about you got to eat right, exercise, stay engaged in the world, have a little fun and laugh a little bit, and work on your brain. That's still good advice no matter what age you are.
Well, yes, but there's an interesting study. There's a longevity study that's come out of New York. Near Barzilai is one of the investigators, where they're looking at centenarians. And it turns out that until the ages of 80 or 85, we're probably in control to the degree that we can do what you just said.
All right.
Once you start getting into your 90s or get close to 100, it's probably more genetic. It's about, as I like to say, choose your parents wisely.
Oh, totally.
Okay.
Yeah. You could see that whenever. How old are you? 85. How old are your mom and dad? Oh, they're 95. I'm like, okay, well, see that you got to win.
And there are people who reach the age of 100 who will still smoke, and that's not because they have engaged in great lifestyle, but because they have something extra. So there's active research going on to try to understand the genetic component. But I think for most of us, it's very fair to say that as you're heading towards hopefully 80 or 85, that we are in control to the degree that we have the ability to do the good things that help us keep functional.
Okay, so now I'm going to ask the big question. So my mom died at 52, my dad died at 70. They're both smokers and all sorts of bad habits, but does that mean I got 5 years left?
No. We still don't have the ability to predict on a specific individual basis what your future is going to be. I wish we all had a crystal ball in that way. So the research I just mentioned is really looking back at what's happened. So no, it looks like you're doing well. I know you're a skier too, Steve.
Yeah, we ran into them. Almost ran into each other there one time.
That's right.
Well, my sister's 76, so I shout out to her because I think that's a good sign. So do you come from good long genes or short genes?
No, my father died of heart disease at 42.
Okay.
And then my mom died a couple years ago of cancer at 72. So I'm concerned.
You got the same profile I got.
Yeah,
We're looking at the same thing.
Yeah, exactly.
Did you think about that sometimes and feel like you want to go out and be more active or try to live healthier?
I think it's why I do the research I do.
Yeah.
Because my dad had undiagnosed type 2 diabetes probably the last 2 years of his life. And back then when he had heart failure symptoms, they told him to retire and go on disability, and that's the last thing they would do now.
Yeah.
He would do cardiac rehab, he would exercise, he'd be on statins. So Yeah.
So I think about this all the time, and so I'm always like, I'm going to do better. I'm going to work hard at this. I want to try and eat healthy, and you try and do good stuff.
And one way to do that, so we know that people 65 and older, that only as few as 12% actually are able to engage in the kind of typically recommended 5 times a week, 30 minutes a day activity. But there's a lot of investigation, including in my group with my colleagues, Ken Seldine, that say if you can do short bursts of activity, high-intensity interval training, and we've actually done work not just in an animal model, but in people, and we have a trial at the VA where 3 times a week, about 10 minutes at a session, can hopefully help to boost your fitness. And that might be a way to sort of integrate staying healthy for a longer period of time, even if you don't have as much time to do the activity.
All right, Allie Love, get on that bike, and man, she kills me on that darn Peloton, or on that darn high-intensity interval training stuff and hills. Holy cow, hitting hills. All right, we are here to answer your questions. Send them using the links on your screen, YouTube, Facebook, or email the Medical News Network. Let's check in with Doc Hawk. Hey, Hawkeye.
Hi.
Before we ask the measles question, you avidly work out all the time, as I recall.
I try, but my bones and my joints are getting to be sore now. So, you know, just the aging thing, that's all.
All right.
I do what I can.
Last time we spoke, we knew about 1 case in measles. Now it's officially an outbreak. KDHE reports 10 measles cases in southwestern Kansas. Talk to us about what we know.
Yeah, so again, in 2025 here in Kansas, we've had 10 cases. 2 of those cases occurred earlier, though. One was in January, one was in February, probably not linked to these other 8 cases, which we have recently seen in the state of Kansas, that are really clustered around each other as far as we know. This is just basically a graph of measles cases by age in Kansas. And as you would expect, as we have seen in previous outbreaks, or the outbreak that's going on right now in New Mexico and in Texas, just younger people who are unvaccinated for the most part are getting the disease.
All right, so let's just say it out loud. If you've been vaccinated, the chance of getting measles is like virtually 0. And if you're not, it's a highly communicable disease if you're around it.
Yeah, this is essentially a disease of the unimmunized. You know, it is unfortunate that we have to talk about it. It is a tragedy that we have to see people hospitalized and deaths from this disease, which has really been stamped out and removed, eliminated from the United States since 2000 for local spread. Again, it's more of the unfortunate tragedy of the illness, of the hospitalizations and the death of these. Most of these are kids, and they are unable to make their own decisions about these types of things, such as vaccinations, to get protection from the immunization. So it is unfortunate, but again, this really largely remains a disease of the unimmunized, unfortunately.
Okay, now we've seen some discourse and some comments from folks saying measles isn't that bad. It's just a rash. Okay, that's probably maybe not the right answer, but how do you respond to that train of thought?
You know, again, the actual data, the information would not support that. We know that 1 in 5 people can go to the hospital. In the large Texas outbreak, we've seen that it's about 13–14%, so not the 20%, but we know that 1 in 20 will get bad pneumonia. We know that 1 to 3 could die. 1 in 1,000 may get the central nervous system infection that can last throughout a person's life. You know, you can have then mental issues or cognition issues, as well as deafness, if it does get into your central nervous system. It is not a benign disease. Unfortunately, it is not just a rash, but you can have long-lasting effects. In addition, this virus also, it infects our immune cells, so it is lymphotropic. So people now, after getting the infection, the virus infects those white blood cells. They can then eliminate a lot of the white blood cells. So we do get an immune amnesia, a mild sort of immunosuppression for up to 2 to 3 years even after having the infection. So it can have short-term but also long-term consequences. It is not just a benign disease.
Yeah, something you don't want to have, measles, when it's so preventable by such an easy and very safe route. Now, just going to deviate for 1 quick second, the federal government has been said that they're going to start a study looking at the link between vaccines and autism. Comment on this, Hawkeye, because I think we've studied that like 100 times, 1,000 times. But B, the person they're going to appoint to head it is a known believer in a link that's been proven not to exist. Talk to us.
Yeah, again, a lot of stances driven by opinion rather than true science and data. We know that this was an unfortunate event that occurred back in, I think, the late 90s, where there was a link associated with this vaccine and autism. That publication has been debunked multiple times. There have been 15 or more excellent peer-reviewed studies showing that there is actually no association, no link between autism and the MMR vaccine. They have been publicized many times. They have been in congressional and Senate hearings about this. But unfortunately, some people still continue to believe that, but there is really no link at all between these two things. And it is very unfortunate. I think not only have we not understood this, or we chosen not to understand that or want to understand that. But unfortunately, this disease, and I've heard this spoken of before, it's not only that we have forgotten this disease as a country, as a nation, but we've forgotten the memory of it and what it really looked like for people to be very ill from this. Now, we have seen quite a few in this most recent Texas outbreak, but unfortunately, we are seeing more and more news reports of cases popping up all over the country. And if you look at the CDC website on kindergarten vaccine protection based on their data, a lot of the states are under or at about 90%, and unfortunately that does not make for herd immunity. So we can still expect to see more and more cases of this disease, and hopefully not more tragedies of hospitalization and death.
Yeah, something we don't need. Yeah. All right. We know many of you have questions. Let's head to Studio B with Alexis Del Cid.
Good morning. Amy has a great question. She'd like it if you could dive a little deeper into biological age versus numerical age, and does that matter?
Oh, that's a great question. Well, it really talks about the differing longevity of different people. Who's going here?
Yeah. Well, I think there's a lot that comes to this. People say age is just a number, which is not quite true. But we now have some studies that are looking at fundamental processes in our cells that can give us a DNA age. We can look at what happens to DNA over the lifetime, and there are changes, chemical changes that are made, and you can track those and look and see people with certain functional capacities and different ages have different DNA ages. And so it turns out that indeed age may be much of a number, but now with this DNA age, we can start tracking this and maybe also predicting what your susceptibility or resilience is to future insults. There are some other things that we're also looking at, and that's like metabolic capacity, mitochondria. Those are the engine factories of the cell. And also there's some neat work being done with what are called microRNAs, which are very small molecules which are in our bloodstream and our cells that also may have a predictive, both a tracking for age and a predictive capacity for as we get older.
Okay, I like it. So bring it on, man. I want to know how old I am.
Well, maybe we'll collect your blood and get your DNA age.
Yeah, there you go.
Vera has a question. Vera wants to know, what is the definition of the geriatric age range, and can you share the benefits of seeing a geriatric physician versus a family practice physician?
So I'm, full disclosure, I'm biased here under these circumstances.
No, we wouldn't have thought about that. Okay.
So it used to be that 65 and older was thought to be geriatric, though actually the baby boomers probably as a group are doing better than before and after when it comes to their capabilities. Yes, I'm a boomer too, Steve.
I'm a boomer,
okay.
barely. I'm not barely boomer, but I'm a boomer.
But there's no doubt that living independently or even living in the community with assistance is something that everybody really wants to do. This again depends, as you've heard me say during this session, that so much on your social support mechanisms, your ability of your family to be caregivers, your financial resources. So yes, there are options besides a nursing home or moving in with a family, but often they're very, very expensive, and those options often can deplete the financial resources. So those are desirable, but often not achievable. And when it comes to whether or not a geriatrician can make a difference. I think that what you want to have is a physician or a nurse practitioner with whom you have a good ongoing relationship. And if you start experiencing some of the things that we talked about earlier, then getting a consult from a geriatric physician or nurse practitioner can really help your ongoing primary care physician make a better approach to the capability of keeping you functionally capable as you get older.
Jeremy Yenser has a question. He writes, I've always thought that things like puzzles and brain teasers keep your mind sharp as you age. Is it truly helping your brain stay sharp, or is it just helping you feel like your brain is doing well because you've successfully completed a puzzle?
What do you think?
Well, I mean, I'm not a neuroscientist, but I think feeling good is what it's all about.
Yeah,
and I will say that physical activity and exercise are increasingly shown to protect cognitive ability as you age.
Yes, I agree with that, John, so much. So there are some studies that suggest that these puzzles don't actually help to improve your true cognitive capabilities. But what does matter is your physical function, because that maintains at a simple level, straightforward level, the blood flow to your brain. And that's really, really important. As we get older, many people, if they have cardiovascular disease, if they've been smokers, they are compromised in that regard. So to stay cognitively fit, it's good to stay physically fit.
We have a vaccination question. This is from Marcia. Marcia wants to know if older adults who were vaccinated in the late 1950s or 1960s need to get boosters.
All right, Hawkeye, how many times should we be boosted?
Yeah, I mean, so there's a simple answer again. If you were born before 1957, that's not what this question was. This question was if you were vaccinated in the 50s, 60s, or if you have received 2 doses of MMR vaccine. Now, there is a little bit of a gray area in there for that late to early 60s period when the vaccine was a little bit different. I just think in that case, for the most part, you should probably talk with your physician, but right now there's no specific recommendation to do that. Talk with your physician, have some shared clinical decision making. If it really is unknown and we don't have any other records of vaccination or getting 2 doses of vaccine, then it's okay to go ahead and get that second dose then and
really no
get a new
reason
dose.
just not to get the second dose.
Yeah.
You gotta wait, just get a second.
Yeah, I mean, otherwise it would be fine. It's just there is that little gray area and that little time period there. So.
All right, this has been a great discussion. I'm grateful to our guests for being here. I'm going to ask for some final thoughts before we go. And Dr. Trone, I'm going to start with you.
Well, I think we've covered the bases when it comes to how do we stay functionally capable and cognitively fit as we get older. If you could bottle exercise and put it in a pill, we would all be doing that, but there is no substitute for that. So if circumstances allow, if you can find a way to stay active, then that's the best way to go about becoming cognitively capable as you continue to get older.
What I hear you saying is that ChatGPT cannot exercise for me.
No.
That's disappointing. Who brought you onto this program anyway? Dr. T.
My comments would be that there are barriers that limit people's physical activity and exercise. So figure out what those barriers are. Two barriers are orthopedic limitations. If you have those, work with your primary care doctor to get a physical therapist referral to get that limitation fixed, or at least put in a way where you can be more active again. And then the other one is excess body weight. And we have wonderful drugs now that can help you lose a little bit of weight so that you're more comfortable when you're active. So I would address those limitations that may be holding you back.
And guys, we just say out loud, we've talked a lot about exercise and the importance of it, but let's not forget range of motion. Let's not forget trying to make sure that we can be stable on our feet. So much of that is about your core strength and your ability to maintain flexibility as you get older. That range of motion, especially the muscle we overlook a lot, is our bottom, the gluteus maximus and gluteus minimus. Keep your butt strong.
Well, that's why if you can't get out of a chair without using your hands, then that's a warning sign.
Yeah, it makes all the darn difference. Okay, Hawk.
Yeah, I would say that, you know, even though I have my AARP card, I think most of my people that I know.
Seriously?
Yeah,
what are you talking about? Where's the grade?
Discounts.
I've got one too.
You're like qualified.
Okay.
Despite that, I think some of my friends would still say I'm more adolescent than anything. But just want to echo, doing that healthy lifestyle. We have had recurrent messages about that and endorsing that healthy lifestyle. It's adequate nutrition, adequate rest and sleep, adequate activity, as we have talked about. It's certainly nice out now. Hopefully people can get out and be outside and do things safely to stay active. And of course, as we have talked about, please stay up to date with your vaccines.
You know, we were talking a lot about today about how to maintain healthy. We started this program out with a little Spock quote, "Live long and prosper." We love it. But if you're really a Star Trek nerd, you'll know that in Galaxy Quest, there was a turn of phrase that may have been even more applicable to this discussion about aging. Never give up. Never surrender. And we just got to keep on working out. And the more we do, the better off we are. Okay, thanks again to all of our guests and to our audience. Remember, we've talked a lot. Faith, hope, and science. Never give up. Never surrender.
Thank you, Dr. Stites. And on the next All Things Heart, from hospital to hospital he bounced, not ever getting a viable treatment. Until he came here to the University of Kansas Health System, learn about the clinical trial that this patient says gave him his life back. That's tomorrow at 8 a.m.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.